Hi, my name is Jessica Perlo. I'm the community manager of the IHI Open School, and I'm excited to talk with some of our students today who are here at the forum. I'll let them introduce themselves.
My name's Chris, and I'm a medical student at the Hull York Medical School. And I've come to the forum, I think, mostly because I had a poster in, so that gave me a good reason to come here.
I'm Ariella Camera, and I'm studying Sustainable International Development at the Heller School for Social Policy and Management at Brandeis University. And I came to the forum because I'm completing a full-time practicum with a quality improvement nonprofit in Boston, Massachusetts called Niche Q. And I have a poster here at the forum that I'm sharing.
Thank you.
My name's Kerry Wilkins. I'm a student studying healthcare policy and management in Birmingham. I came to the forum off the back of an email from the NHS Institute for Innovation, and just thought that there were some really eminent speakers, and was dragged in by the email.
So what do you think is the most valuable thing you've gotten out of the forum this year?
Well, I think for me, especially because I didn't come here sort of expecting... Well, to be fair, I don't think I knew what I was expecting. It was mostly that I had a poster in, I wanted to present that and see what was here when I was here. But it's been really, really interesting seeing loads of other students and junior doctors that are involved in quality improvement in lots of ways and have done interesting things. And I think that really challenges you to think what you can do yourself and what you could do to improve. And I think that's by far been the most valuable and much more valuable than sharing the poster.
That's great, thank you.
So I'm very new to the quality improvement field and heard about quality improvement for the first time about 8 months ago when I started my field work. And so for me, just coming to the forum has been a great opportunity to learn about all of the quality improvement projects that are going on around the world. And they're all so different but have very similar core values and use similar frameworks. And so it's really interesting to see the movers and the shakers in this industry, and also meet students who are trying to actually learn these frameworks and integrate them from, you know, the early stages of being educated and being in school.
That's great, thank you.
I think the thing that I've most taken from the last 3 days is just being re-inspired and re-motivated. I think when you get so used to the churning out of essays and reading constantly, to meet people and actually interact with people, and you can get so lost thinking you're the only, not the only person that wants to improve, but you're the only person that has got similar ideas, or that you don't know where to take those ideas, or who to talk to, or that you might be absolutely ridiculous in those ideas. It's really nice to meet people that are like-minded. I know we've said that loads, but it's absolutely been the best part about it, and to, as cliche as it sounds, learn from each other.
Yeah, absolutely.
And people have been doing such different things as well, because I mean, we're sort of all native English speakers, you know, 2 Brits and 2 Americans, but that's not really a representative sample at all of what we've got here. No. And I think it's really, really interesting seeing what people have done in really different healthcare systems, and being able to sort of, I suppose, take inspiration from that, and ideas for what could be done at home.
Hugely. The poster exhibition, I know you've both got posters, haven't you? I wasn't unaware. I was unaware of the forum until recently when I saw that email, because I certainly would have mentioned it to university or local hospital. There's some fantastic projects going, but the poster exhibition has been absolutely brilliant. All the ideas that there are, and there's so many of them. And the good thing about the Open School is that you have created this network of people that you can talk to, and there are so many good things going on, and there's so little or so few ways of those people being connected at the moment, especially, I don't know if you've in the UK, that they're not that connected. The IHI help provide that.
Do you plan to stay connected after the forum?
Absolutely.
Good.
Yeah.
Does that sound like a plug?
How will you take what you've learned back to your institutions?
So I can start. So I went to a few sessions around patient engagement, and so our organization does a lot of work with integrating patients into our quality improvement teams. And so I'm going to take some of those lessons back and share it with our team and our organization, along with the leadership lessons too. We have lunchtime workshops at our organization, and so I'm going to hopefully lead one on all the different learnings that I've kind of gained from this forum and just share it with our organization, because we really have a heavy focus on just learning and collaborating and really trying to share everything that we experience at different summits and forums and stuff like that.
And you'll be at the Leadership Academy this year.
Yes.
Congratulations.
Yes, and I'm very excited to meet other students and continue to develop as a leader. I feel like it is definitely a continuous process to grow and learn. And I went to some great leadership sessions here about being an organizational radical. And I think sometimes you can feel alone when you're trying to make change. And the best thing about this forum is you're around other people who are trying to make change too, so you don't feel alone anymore, which is great.
That's great. Thank you.
No, it's interesting in terms of, where to start if either you're new to it or you're not aware of or part of the culture of change in an organisation. And so many people have just started doing the really simple thing of just talking to their colleagues and taking the time to have a meeting and suggest changes and think about how it could be done. And even if some colleagues might be unreceptive or resistant, if you talk to enough people, you're going to find someone that wants to get on board with you. And from talking to people, it seems to be once you've got going, it's easier to maintain that momentum than it is to start it.
It's similar to how I was feeling, because being in sort of health policy and management, I don't know if you have something similar in the US, but you'll probably agree here, and from a UK perspective, it feels like sometimes there's quite a divide between administration, management and clinical. And I think sometimes talking to the people that I've met today and so many junior doctors and medical students, that I think sometimes we put this barrier there that isn't there. When I'm working in service improvement, if I knew that there was junior doctors out there that wanted my help and support, and I can bring that service improvement and the quality methodology to them, and they have the ideas and they know where things need to change, and we just need to bring each other together, and that's made me realise that I didn't think that I would have that opportunity, and that junior doctors and medical students would be responsive to that. And similarly, talking to the junior doctors, they don't know that there are people in hospitals who are trained in these methodologies, who do understand and can provide support. So that'll be the first thing I go and do, is try and find these people.
That's great.
That's so important. I feel like I've been thinking a lot about interdisciplinary teams and how it's so critical to have different stakeholders just on your team when you're talking about making change or quality improvement and coordinating care. Because it's not only junior doctors and physicians, but we also have social workers. And in the US, we have nurse practitioners that meet with patients and are also making change. So really integrating our teams and starting those hard conversations are really important. And I feel like we've been talking about that a lot here at the forum.
Great.
My favourite quote or part has been Maureen's opening. That probably started the inspiration for the week. What matters to you, not what's the matter with you. I think I'll take that back. As cliched and as much of a tagline that might sound when you get back to the real world, it's really stuck with me.
Yeah, I think it's really sort of interesting from a medical perspective, because I think unsurprisingly in medicine there's a culture of, or should be a culture of, trying to provide holistic care and be person-centred and sort of ask those sort of questions, what can I do for you? But I think often the subtext of that question is clinical and it's medical, and it's not thinking about all the other things that could be done. Not just simple things like getting water, but things that could be done to improve the system so that it's better for that patient, but also better for the next patient. And I think if you can improve things generally, then you're going to improve clinical outcomes with that. So it seems an obvious thing that doctors should be thinking of more.
Don't you think we make so many assumptions, though, about what kind of things patients and the public want? And that's kind of made me realise that the video we saw towards the start of the week, the diabetes patient, you make so many assumptions about what is important and how people deal with things and what they understand, and we need to look at it again, really.
I think you're absolutely right. I mean, we were discussing just now that, you know, part of the difficulty often, I think, when working with patients, either from a policy perspective or a medical perspective, is that often there's a power imbalance, right? One party feels that they're the expert, and they've done all this before and they know what's right, and they know best, so they're going to just push through what their ideas already are without considering the other stakeholders. And that's probably really dangerous, actually, in a healthcare setting.
Yeah.
So that's a useful thing to take away.
And it's really interesting. So from the fieldwork I've been doing, one of the most powerful things I've seen is on some of our teams, the healthcare professionals often can get stuck. Like, we've done that already. It didn't work. We know it doesn't work. It's not going to happen. You know, we don't have the funding. And sometimes it's the parent on the team who is like, we're going to do this. Like, I have this great idea about how we can make the care better by having a simple roadmap of care coordination that is in Spanish and English for the parents to have to show what the next step is. And so sometimes the parents are really the drivers of the innovation because they're coming in at a different angle. And so I think that is so critical.
Yeah, and student-wise, I mean, there's been a couple of talks now that have mentioned the hidden curriculum, this process by which that you've got people that have perhaps been in the organisation a very long time and don't feel that change is either appropriate or likely to occur. And how students can become indoctrinated and inculcated into that value and that belief set, and so become a barrier to effective change, which is a bit of a shame, really, because it is just a belief set. Often it's not true, and whilst, you know, things might not have worked in the past, it probably doesn't mean that's because change in the broadest possible sense is impossible or not likely to work, but rather it wasn't done well that time. What can we learn from it? What could we do different next time?
Yeah, that's been a really nice thing, actually, about the IHI, and every speaker that we've had here from the IHI has had a genuine interest and belief in students being the future, and I think sometimes that's quite novel because I trained clinically, so I speak first-hand from this as well. As a student, you can quite often just feel like a burden or an extra, and I think sometimes students don't have potential recognised, and they bring their own set of unique benefits, and the IHI genuinely, from everything that we've seen, recognises that and wants to help students, which is a really nice attitude to take.
That's why I appreciated the student orientation and how we learned about the one question slogan that is happening, and how junior doctors are being encouraged to ask their patient one question. And so just talking and learning about that and like setting the tone of the forum off with that student welcome orientation, I think was really helpful.
Well, thank you guys so much for being here.
Thank you for having us.
It's been really good.